One is to be aware that just getting your patients to survive their critical illness is not good enough, that these patients have long lasting implications of their critical illness, and that one cannot ignore these and say that it will just get better, because they may not. So it's important to realize that these deficits do occur. It's important to realize that there are potentially modifiable risk factors that one can tackle. And while there are no definitive studies yet, there is evidence that is mounting that sedation, delirium all play a role, and that all the supportive therapies we do, which reflect good clinical practice, all make an impact. And so trying to get that part in your ICUs is really important. And then the third is that over a period of time, hopefully, and at this point, you might find that you can identify a vulnerable patient, and those patients may be someone who you can refer to get these additional therapies upfront, knowing that they are going to get into trouble later on. So I think those would be my three take-home points. We can make a difference, and I think that is important.